Hi, my name is Mariska Oberg, and on July 1st, 2021, I will be presenting Strep Throat. Typical patient presentation. A 10-year-old female presents with a fever of 101.6 degrees Fahrenheit that started 6 hours ago, a sore throat, and enlarged tonsils. Mom states that she is in public school and an infection has been going around. Patient states that she did not want to eat dinner because she was not hungry and that it hurt to swallow. Etiology of the disease, the underlying cause. Strep throat is an infection from the bacteria group A strep, also known as Streptococcus pyogenesis, which is a gram-positive cocci that grows in chains. Background. Group A strep infects 11 million patients a year, is the most common and infects 15 to 30% of cases in children and 5 to 10% in adults. 1 in 4 children with an acute sore throat will be diagnosed with group A strep. Late winter and early spring are the peak in group A strep season. It is transmitted by respiratory secretions and the incubation period is 24 to 72 hours. Risk factors. Age. Although any age can develop this infection, school-age children and adults in contact with school-age children are at higher risk. Time of the year. Although strep throat can develop at any time, it tends to spike in late winter and early spring. Pathophysiology. Group A strep is spread by person-to-person contact, such as saliva or nasal secretions. Streptococcus pyogenesis is a gram-positive microorganism that causes infections to the throat and the skin. The first step of Streptococcus pyogenesis is the bacterial adhesion of the invasion of human epithelial cells via the VN binding proteins of Streptococcus pyogenesis. This escapes the body's neutrophils by invading the C3b and degrading the nets, the neutrophil extracellular traps, at the infection site. It grows in the blood and can be found in loose connective tissue. The growth of the infection can lead to strep throat. Symptoms. One of the most common symptoms for group A strep is a sore throat, which is an invasion of the pharyngeal mucosa that causes a local inflammation response leading to a sore throat. A temperature greater than 100.4 is also another symptom. This is your body's reaction to fighting the infection. Tonsillar exudate is the third most common symptom. That is a film that is secreted by the tonsils causing an inflammation of the tonsils, which you can see as the white dots on the tonsils in the picture. Diagnosis. Group A strep is hard to diagnose solely on clinical findings because of how closely they overlap with other infectious diseases. Due to this, the original center scores was created using 4 signs to estimate the probability of group A strep. A patient with a score of 0 to 1 are at low risk and require no testing. A patient with a score of 2 to 3 should be tested, and a patient with a score of 4 or higher are at high risk and empiric treatment may be considered. Continuation of diagnosis. The picture to the right are the original center scores for determining a patient's infection of group A strep. As you can see in the picture, a physician will add up all of the points for the criteria and match up with the points for the score on the bottom, which will state what their percentage of risk for it and how to treat them. Continuation of diagnosis. The 2 tests include a throat culture and a rapid antigen detection testing, RADT. An RADT allows for early treatment, symptom improvement, and reduces the risk of infection spreading. If a child has a negative RADT result, the American Academy of Pediatrics, AAP, recommends a throat culture to confirm the negative RADT. Complications. The complications can be split up in 2 different categories: suppurative, which is to form or discharge pus, and a non-suppurative, which is an inflammation not accompanied or characteristic by suppuration. Suppurative complications include meningitis, pneumonia, or peritonsillar abscess. A non-suppurative complication would be rheumatic fever. Suppurative complications can occur when the infection spreads from the pharyngeal mucosa to deeper tissues. Continuation of complications. Meningitis is an inflammation of the protective membranes covering the brain and the spinal cord. Bacterial meningitis is caused by the same bacteria that causes strep throat. If left untreated, it can lead to sepsis. Pneumonia, an infection that inflames the air sacs of one or both lungs. As the bacteria that causes strep throat moves into the lungs, this is what causes pneumonia. Peritonsillar abscess, which is an infection that begins as a complication from strep throat, a pus-filled sac surrounding the tonsils. Continuation of complications. Rheumatic fever, ARF, is a rare disease in young children. Only 5% of the first episode arise in children younger than 5, and it is almost unheard of in children younger than 2. ARF is common just before adolescence and rare in adults over 35. ARF is the result of an aggravated immune response to a specific bacterial epitope in the host. When a specific bacterial epitope binds to an antigen, it signals an immune response against the host of the epitope. Rheumatic fever was high during World War II and digressed to the 1970s and 1980s. This was due to a change in nutrition, decreased crowding, and alterations in the pathogen's immune-stimulating potential. The reported annual incidence of acute rheumatic fever is 1 case per 1 million. Continuation of complications. ARF can lead to complications such as heart failure. Heart failure can occur when a patient has had an attack of ARF. Each reoccurrence of ARF puts a patient at further risk for developing the heart failure. Once diagnosed with ARF, prevention treatment begins. The recommended prevention treatment is continuing antimicrobial prophylaxis by using prophylactic antibiotic. Treatments. Group A strep is a self-limited and can resolve within 24 to 72 hours even without treatment. Antibiotic treatment can be used for the prevention of complications. Antibiotics can include penicillin, and penicillin is recommended based on the cost, narrow spectrum of activity, safety, and effectiveness. If a patient is allergic to penicillin, erythromycin is recommended. Continuation of treatments. Chronic pharyngeal carriage is the consistent presence of Group A strep without an active infection. In this case, antibiotic treatment may be implemented. A tonsillectomy, which is a removal of the tonsils used to decrease the risk of chronic throat infections. Indications for a tonsillectomy include recurrent throat infections with at least 7 in a previous year and 5 in the previous 2 years. These are my references. Continuation of my references.